we approve those first, though, before we go into the contracts. Okay, good morning. Welcome to the Cook County Health Board meeting, Friday, June 26th at 9 a.m., a little bit after 9 a.m. And so I'm going to ask the secretary to call the roll of the attendance, please.
Director Bott, Director Harrington, Director Kim, Vice Chair Lowry, Director Masuda Barnett, Director Ryder is absent, Director Robinson, Director Sorrell, present, Director Staines, here, and Chair Garza.
Present.
You have a quorum.
Thank you, Madam Secretary. The next regular meeting of the Cook County Health Board will be Friday, July 31st at 9 a.m. And not have any directors who are remotely connected in for the meeting. Right?
That is correct.
Okay. So we'll move on to item 2 of the agenda, and that is employee recognition. I'll turn it over to Dr. McItis, who serves as our Chief Executive Officer.
Thank you, Chair Garza. Good morning, directors.
Good morning.
Good morning.
Yeah.
Oh.
We're waiting for the slides. If the team members are in the room who are being recognized, please stand. Wonderful. So earlier this week, we had 93 students and their families participate in the Providence Scholarship Ceremony, where in partnership with the Health Foundation of Cook County, we awarded $1 million in scholarships. And just for background, since its inception in 2022, we've now distributed more than $5 million to 380 future healthcare leaders. Yeah. And congratulations to our 50 leaders who completed the new Frontline Leadership Development Program. This is an immersive 18-month program designed to build critical leadership skills through practical tools, actionable techniques, and real-world applications. Our leaders turn learning into intentional action. We have additional cohorts ramping up at CERMAC, at Providence, and in other departments. Congratulations, team. And our Department of Public Health Tobacco Prevention and Control Program team is being honored by the Respiratory Health Association's upcoming summer reception, 2026 Making a Difference Tobacco Control Award. CCDPH and RHA have long collaborated on policies that have made Cook County and Illinois a healthier place to live. One major accomplishment was increasing tobacco sales age to 21 and restricting access to flavored liquid nicotine products. Congratulations. And congratulations to this month's Commitment to Excellence winners. We thank them for everything they do for Cook County Health, our team, and the individuals and communities that we serve. We want to especially recognize Susan Walsh with Supply Chain, Dr. Bozana Alexander with Anesthesiology, Ananya Stoller, and Marcy Elliman with County Care. Congratulations. And we also participated in a citywide disaster exercise on June 4th. This exercise included Stroger and Providence Hospital, where we received mock patients as part of a coordinated mass casualty incident scenario. The drill was designed to strengthen our preparedness and enhance our ability to respond effectively during large-scale emergencies. Thank you to everyone who participated and cooperated. That commitment ensures that we're ready to respond to any kind of a disaster. Thank you, team. And in recognition of Mental Health Awareness Month, our Cook County Health Office of Behavioral Health partnered with community organizations and hosted a two-part Facebook Live series focused on youth mental health. The conversation provided parents and caregivers with practical tools to better understand youth mental health, recognize early signs of stress and anxiety, and connect with available support and resources. Congratulations. And on June 11th, we led an open interactive discussion on men's mental health and physical health. And a special thank you to Dr. Turner, Dr. Loafman, Dr. Balthazar, and Dr. Stroy for leading a very insightful discussion. And just 2 days ago, we hosted a press conference with President Preckwinkle and Commissioner Lowry to celebrate Cancer Survivors Month and highlight the birthday health screening program. We had elected officials, clinical leaders, and patients speak about the importance of cancer screening and equity in cancer care. That's it. Okay, I'll hand it back to you, Chair Garza. Thank you.
Thank you, Dr. McCarty. There's a lot of great things going on around the county and the communities. We'll move to item 3, public testimony. Madam Secretary, are there any speakers registered to provide virtual or in-person testimony, or has anyone sent in written testimony to be included into the record?
We have one registered speaker, Brenda Langford, and she is virtually connected.
Okay. Ms. Langford, please go ahead.
And as a reminder, you have 3 minutes. I'll give you a heads up when you have 1 minute remaining and when your time is elapsed.
Yes, ma'am. Thank you. Good morning. I am Brenda Langford. I'm a registered nurse at Cook County Health and the board member for the NNOC nurses. Thank you for allowing me the opportunity to speak today on behalf of the nurses. I am here to ask you to honor the commitment that was reached during negotiations regarding the $5 daily transportation per diem for nurses in the integrated care departments who are required to use their personal vehicles to perform their assigned duties. This issue is about more than $5. It's about fairness, respect, accountability, and trust. During a marathon day and night of negotiations extending past midnight into the early mornings, the parties worked tirelessly to reach an agreement to extend the existing collective bargaining agreement rather than negotiate an entirely new contract. These discussions required compromise, patience, and a commitment from both sides to resolve outstanding issues, grievances, and move forward. During those negotiations, the NNOC union bargain team advocated for the same $5 daily travel reimbursement that public health nurses have received for years. This was not a new concept. It's a matter of equity, ensuring that employees who are performing similar community-based work are treated fairly. Employees who are required to use their personal vehicles to perform essential job duties in the field should not be expected to personally absorb the cost of transportation that directly supports the organization's mission. When nurses are driving to complete in-person assessments, visit patients, provide community services, and carry out essential community-based visits, transition of care functions, and state-guided waiver services, that travel is not a personal choice, it is a requirement of the job. The vehicle becomes an extension of the workplace. A $5 transportation per diem helps offset the unavoidable expenses that employees incur, including fuel, maintenance, insurance, and vehicle wear and tear. While it does not fully cover the true cost of operating the vehicle, it is a meaningful recognition that the organization values the employees who make this work possible. Unfortunately, what has brought us here today is not simply a disagreement over reimbursement. It is the concern created when management and BHR fail to honor agreements reached at the bargaining table. And when those commitments are later questioned and withdrawn, it damages the foundation of trust required for successful labor relations. Good faith bargaining requires more than sitting at a table. It requires honesty, transparency, and integrity. When employees negotiate in good faith, they expect the same in return. The nurses who serve the community deserve to know that words spoken during negotiations have meaning, and they deserve to know that agreements reached after long hours of difficult conversations will be respected. It demonstrates the leadership values the employees who show up every day, travel to the community, care for patients, and uphold the mission of this organization. We respectfully ask the board to stand for fairness, accountability, and integrity by ensuring that this negotiated commitment is honored. Thank you.
Thank you, Ms. Langford. As I understand it, this is a matter that is subject of arbitration at the county level, and the Cook County Health Board cannot comment on the matter. But we appreciate your testimony. Thank you.
Thank you.
I will now move to item 4, board and committee reports. And, the minutes of the May 29th, 2026 board meeting, I'll present those and I'll ask if there are any corrections that are needed. All right, hearing none, I'll ask for a motion to approve item 4A, the board meeting minutes of May 29th. I guess it's 26th, sorry, May 29th, 2026. Can I have a motion, please? So moved. Thank you.
Second.
Thank you for the second. Is there any discussion or questions? Yes. Okay. We'll finish this motion and then we'll move to your statement. Thank you for raising that. Thank you, Sam. No questions or comments? Okay, all those in favor, say aye.
Aye.
Aye. All those opposed, say nay. Okay, the motion carries. Please welcome to the podium. Good morning.
Good morning. Good morning.
I would also like to city and the bargaining that negotiated with my contract extension. Agreed to are still not being enforced, such as the $3 per hour critical care differential, especially for our nurses in the emergency room and at Providence Hospital. The $2.75 per hour chemotherapy inpatient differential for nurses in the medical surgical units, and finally the $3 charge nurse relief for nurses covering the absent nurses, the C&2s. As nurses on the front line, we are constantly overworked, short-staffed, and underpaid. It is unacceptable that our wages are not being correctly paid when we give so much every day and night to our patients. It is not okay that day in and day out, we work extremely hard to provide valuable and necessary quality care to the most vulnerable population. We should not have to beg this committee and our nursing management and human resources to pay out these outstanding differentials effective immediately and retroactively. We are Cook County nurses. We love our jobs and the communities we serve. We are urging this committee to investigate these matters and demand that human resources, the financial department, payroll, correct these matters as soon as possible. We urgently request you use your authority and demand Cook County get their act together and make our nurses whole. Justice delayed is justice denied, and we demand justice for our labor. Pay us what we are owed. Show us that you care so we feel appreciated and supported, so we can continue providing the highest quality care to the residents and families of Cook County Hospital. Also, it has been brought to my attention that perioperative recently had a job fair on May 21st, and we were informed that only one nurse was offered a position and accepted.
1 minute remaining.
One nurse, I can tell you that there are currently 30 agency nurses working in the main operating room, 30. These facts are unacceptable, and we urgently ask the board to please look into this and take immediate action. We are in dire need to hire more regular staff nurses in the main OR. It's not okay when nearly entire units are ran and employed by outside agency nurses. That is not right, and something needs to be done to hire and retain nurses in the main OR and also throughout the hospital. Thank you so very much for your time, your attention, and consideration. We look forward to continuing working with you and addressing these matters. Thank you.
Thank you.
Thank you.
Appreciate your testimonial. We'll move on to item 4B, minutes of the June 5th, 2026 Audit and Compliance Committee meeting. And I'll ask Director Harrington to review that.
Thank you, Chair.
You're welcome.
The Audit and Compliance Committee met on Friday, June 5th at 10 a.m. Our next regular meeting of the committee will be held on Friday, July 10th at 9 a.m. The purpose of this meeting was for a closed meeting review and discussion of the reports relating to the audit of the fiscal year 2025 CCH financial statement and required communications for the external auditors. That review and discussion took place in a closed meeting, and there were no action items presented for the consideration at that meeting. Other directors who are not members of the committee also joined us for the review, so we're not planning to re-review the closed meeting reports with the full board today. Although they are not present today, I'd like to thank the external audit team from RSM, including Lori Callett, partner and healthcare senior industry analyst Tyler Samuel, assurance senior manager, healthcare and insurance. And if there are no questions on the minutes, they are being presented for the board's consideration at this time.
Thank you, Director Harrington. I'd like to ask for a motion to approve item 4B, the minutes of the meeting of the Audit and Compliance Committee that took place on June 5th, 2026. Can I have a motion, please? So moved.
Second.
Second by Director Kim. Are there any questions or comments? Discussion? Hearing none, all those in favor say aye.
Aye.
All those opposed, say nay. All right, that motion carries. We'll move now to item 4C, minutes of the June 12th, 2026 Quality and Patient Safety Committee meeting. I'll ask Director Bott to please review.
Thank you, Mr. Chair. The Quality and Patient Safety Committee met on Friday, June 12th at 9 a.m. The next meeting of the committee will be held on Friday, July 24th at 9 a.m. The committee approved the following action items, which are included in the minutes. Approve one Stroger Division Chair initial appointment. Approve a Stroger and Provident Hospital medical staff appointments, reappointments, and changes. The committee received the following reports, which are included in the minutes. Regulatory update for Stroger Hospital, Provident Hospital, ACHN, CIRMAC, CCDPH, and County Care. The committee also received a closed meeting report. There are no other questions on the minutes. They're being presented for the board's consideration at this time.
Thank you, Director Bott. Motion to approve item 4C, the minutes of the meeting of the Quality and Patient Safety Committee that took place on June 12th, 2026, which include approval of the following items. One, the Stroger Hospital Division Chair initial appointment, and the Stroger Hospital and Provident Hospital medical staff appointments and reappointments and changes. Can I have a motion, please? So moved.
Second.
Thank you, gentlemen. Is there any discussion, questions? All those in favor say aye.
Aye.
Aye. All those opposed? Okay, that motion carries. Moving right along. We will now go to item 4D, minutes of the June 4th, 2026 Finance Committee meeting. I'll take those in place of Director Ryder, who's out today. So this will be a little bifurcated into two sections. So the first is that I'm asking for a motion to approve item 4D, the June 4th, 2026 Finance Committee meeting minutes which were primarily informational. So can I have a motion on that, please? So moved. Thank you.
Second.
We have a first and a second. Are there any questions or comments? All those in favor say aye.
Aye.
Aye. All those opposed? Okay, that motion carries. Now we will move to item 5, which has to do with contracts and procurement items, of which a total of 16 are being presented. So the Finance Committee reviewed these at their meeting of June 4th, but did not have a quorum to vote to act on this particular item. So on the screen are the contractual requests over $1 million for your information. And request number 14 is pending review by contract compliance. If the directors have no further questions on these, they are being presented for the board's consideration. Again, keeping in mind that we didn't have a quorum on June 4th. So with that said, I need a motion to approve item 5A, contracts and procurement items containing request numbers 1 through 16, subject to completion of the review of contract compliance.
So moved.
Thank you.
Second.
We have a first and second. Is there any question, any comments? Hearing none, all those in favor, say aye.
Aye.
Aye. All those opposed? Okay, that motion carries. All right, chair report, item number 6. So I do have a few things I want to share.
That was the motion that
That
we
was
just
the
did,
action
the action item 5A.
Yeah.
Yeah. Thank you.
Okay, moving to the chair report. So I've been working closely with Dr. Makaitis on a number of things. Certainly, we have a chance to hear a lot of the positive things that are happening at Cook County Health, and I'll have more to share in a minute. But there are tensions that the leadership is trying to overcome. So specifically, it has to do with the Cook County Health budget. So the county presented a preliminary fiscal year 2027 budget last week. And what it appears to result in is that the Cook County General Fund is expected to face a budget shortfall of $336 million. Initial estimates put the health fund's gap at over $214 million. So these gaps are largely driven, there should be no surprise, by a number of areas. So one, external pressures beyond the county's control. We start to see that about 18 months ago, unpredictably, including court decisions, specifically the Safe Roads Amendment. We've heard at great length about the federal cuts, particularly to Medicaid eligibility, as well as the growing pension and employee costs. And we heard a little bit about that today in the testimonials. So I'm very confident that the health team is preparing its final proposed budget with all these things in consideration, and that will be brought forward to this board later this summer. I think it's safe to say, or suffice to say, we're entering into a very challenging year. The effects of the federal funding and policy changes are already impacting the healthcare system. The county is already seeing high numbers, increased numbers of more uninsured patients. We are seeing fewer patients with Medicaid coverage, and then of course on our healthcare plan side, county, we're seeing increased medical claims. I'll remind everyone that it was last year that there was a 10% across the board expense reduction, and another cost cutting exercise earlier this year. So there's a lot of hard work that's going into putting this 2027 budget. And I was asked the board just to ensure that you're engaged and that you're familiar with these tensions that the team is trying to overcome. I think on the upside, there is a lot of exploration going on, really pursuing additional opportunities for revenue generation and further expense reduction. And while never compromising the mission of Cook County Health, and rather upholding that mission to provide essential health care and services to individuals and communities we serve. So the kinds of conversations that Dr. Makaitis and I have had are really centered around how do we figure out how to continue to get health care to people that need it, irrespective of their eligibility for Medicaid insurance or otherwise. I think that's what the team is committed to trying to figure out. So we look forward to reviewing the health system budget in August. And I want to thank the entire board, because I will need your support when that gets presented, as we enter what, without a lot of sensationalism, which I think will be a tumultuous year financially. Let's move to the more positive highlights. So the health system has made strong progress towards achieving this place of being in a value-based care, place of excellence, and as it relates to its contract goals over the past year. So I'm going to share some data because this is where I've started to drill down and really want to better understand the work that goes below what we get presented as highlights every month, whether it's through committee, subcommittee meetings, or this board meeting. So for one, the number of patients with an annual wellness visit was sitting at 5% just over a year ago. And because of the improvement efforts, that has now increased up to 28%. So that is a 560% improvement. So that is very dramatic. And you know, I don't know that this is data that was shared previously, but it's data that I am asking for and really seeking to understand, are people getting better in our system? And I think this is one way to have a proactive approach of really making sure people are getting in, like we all have the benefit of doing if we're on a commercial insurance. So I think that in itself deserves recognition. So great work as a team on that. I'm not through yet, so more. So
was in order.
Yes, there will be more, I think. We also went from meeting what was the quality metrics, looked at where we're at a year ago, and this is when Dr. Makaitis was really just coming into his first year, and so that now has improved those quality 20% now to 75%. So a 300% increase, and that definitely deserves applause and recognition. So excellent work. So I think it's fairly easy to say that these improvements reflect Dr. Makaitis and his team's commitment to modernizing how we deliver care. I think we've heard a lot of stories over the years about the challenges that we face with turnover at key positions, but now in really just 18 months of me in this role, we're starting to see some significant returns where it matters, and that's in patient care. So I think strengthening performance, as we're illustrating, continues to move the Cook County Health System towards this value-based care place of excellence, and I think that will coincide with the budget work that they're really completing here in the next couple of months to bring forward to the board. And just one other thing that I'll quickly highlight is that there's a major effort in really trying to optimize scheduling for all the things I've mentioned, especially around the budget tensions and the challenge of making sure that people are still getting not just healthcare, but high quality healthcare. So the administration will begin a comprehensive review and redesign of provider and support staff scheduling across the entire organization. So obviously call for the support of department chairs and service line directors who will have to work in a collaborative way with operational leadership to evaluate what those current scheduling practices are and what are the opportunities for dramatic improvement with that. And simply the goal is to increase patient access to care while strengthening the long-term sustainability of the healthcare system, which I think every healthcare system should be doing in this country, given what we're about to see in 6 months and in a week. So we're really the rationale for the change. So I'm trying to give you the what, the why, and the how. Is that there's limited clinic session availability. As I said earlier, there's growth in the number of uninsured patients, growth in Medicaid claims, and that also results in growing patient wait lists. And that results in delays in access to care and obviously a dramatically increasing demand for services. And I think I've covered at great length some of the financial pressures. So as we continue to hear monthly, I think it's probably prudent on our part to keep these things that I'm highlighting in mind as we hear from the chairs of the committees and the staff that are leading those areas. So there's, again, a lot going on. There will be more going on, and we're here to support the leadership, staff, and those challenges. That will conclude my report, and you could probably expect lengthy reports like that in the future, because I'm really working hand in hand with Dr. Makaitis to understand exactly what the good things are that are happening, but also the tension points. So with that, I am going to move to item 7, which is the CEO report, and I'll toss it back over to Dr. Makaitis and his staff to present a few items for us.
Thank you, Chair Garza, and thank you for those kind words and for including me in those comments, but it was the heavy lift and dedication and hard work of a lot of different teams in the health system that have really started to move the needle, and I know I have every confidence in that team that we'll be able to navigate the budget challenges as well. So I think, is Andrea Gibson here with us? Oh, okay. So we have 2 items for the report, strategic plan and ARPA update with Andrea Gibson, and then a divisional report with our Provident team presented by Dr. Turner and Mike Moonen.
Morning.
Good morning.
Andrea Gibson, Chief Strategy Officer. The first update is on ARPA. So we've been continuing to chip away at how much is left to spend on ARPA. This indicates about a $5 million improvement from the last time I was here. And as a reminder, we have a couple milestones coming up. End of September, we are ending a lot of the subrecipient work, and then the focus from the end of September through the end of the year will be to pay all outstanding invoices. But by the end of December, our goal is to have spent that whole amount. Next slide. So I'll highlight a couple things on the strategic initiatives list. Under quality, safety, and experience, we had an uptick in the likelihood to recommend for specialty care and also likelihood to recommend for help with a serious medical condition. A pretty significant increases there from 48 and 46% to 68 and 66% respectively. Also, county care, the CAP survey concluded, and all signs point to placing us in the 90th percentile, so a 5-star rating for that. Under workforce, HR introduced a new HR service link to improve the tuition reimbursement process, as well as other functions in HR. Under transformation and growth, I'll highlight that the sleep lab was moved from Stroger to Provident, and that is operational at Provident now. In addition, some clinical documentation notes. We've been working over the past year on improving the number of notes that require attestation if there's a resident involved, so to decrease the outstanding number of notes. And of course, that all feeds into a revenue cycle. Under fiscal resilience, the finance team worked on updating the Medicaid wage index that helps us achieve a $15 million improvement in Medicaid reimbursements. And some of the things that are coming soon in county care, a new risk adjustment rate for county care that should help county care's bottom line by about $20 million, as well as county care renegotiating some of the contracts for $12 million in savings. I'd be happy to answer any questions you may have.
Any questions? No? No? Thank you, Andrea.
Thank you.
Appreciate the report. Now we'll move to the divisional report, Providence Hospital. Morning.
Good morning. Good morning. Good morning. I'm Dr. Arnold F. Turner, the Chief Hospital Executive of Providence Hospital, Cook County.
And I'm Mike Moonen, Chief Nursing Officer, Providence Hospital.
Since the last time we presented to the board, I want to highlight some of our quality and safety experience initiatives. And the one that we're most proud of, which you are already aware of, is the Leapfrog Top General Hospital Award that we received for the second year in a row back in December. Our hand hygiene compliance has increased to 90.93%, surpassing the goal of 90%. We've had several accreditations to come through for departments in our hospital. Our Echo Lab received a 3-year accreditation from the Societal Accreditation Commission for Echocardiography. Our mammography passed the Medicare Quality Standards Act survey. Nuclear medicine passed the IEMA survey. And our food service is preparing for this IDPH inspection. Has not occurred yet. We collaborated with Stroger to provide weekend registered dietitian coverage, which keeps us in compliance. And in FY 26, there have been no hospital-acquired infections, and that continues to be none. Initiated planning to expand the waiting area and access to preoperative registration for patients to improve the patient flow for surgery at Providence as we continue to increase that volume of the security coverage provided in the hospital. For our staff. Falls Council was created for nursing, and the tablets were launched for rounds for nursing. But the main priority for quality that we're preparing for, next slide, please, is our upcoming triennial Joint Commission survey. We entered the window officially on June 8th, and at any time now the Joint Commission can come in and conduct the survey. We've been preparing for it, but in order to get us more ready for the survey, we contracted with a consulting group to come in and do a mock survey. As you know, when the Joint Commission comes, they will grade us through using the safer metrics that looks at the frequency of findings. They list all the findings that they find there, and the frequency and the severity of the findings. So going from low to medium and widespread to low, intermediate, and high as far as severity. And the category we definitely want to stay out of is immediate threat to life, which would end the survey. So on May 18th through May 20th, the consultants from Kissinger Hospital Accreditation consultants came and did a 3-day survey. The surveyors from Kissinger are members of the Joint Commission Advisory Board. The 2 surveys one was clinical and one was for facilities, the physical environment. The one for the physical environment actually helped write some of the standards for the Joint Commission. So they have to say they were very thorough. They left no stone unturned. And actually, we went into the survey with the mindset that we wanted them to find what they could find, to point out where we need to improve. So after they come, we want to get ready for the Joint Commission survey so that when the Joint Commission survey, they're going to have to work really hard to find something at Providence. So it was a 3-day survey, 3 days for the clinical and 2 days for the physical environment. At the conclusion of the survey, we had findings for 27 standards, rather. and there are a total of 201 standards and 742 elements of performance. At the end of the survey, we had no immediate threat to jeopardy findings. We did have some findings that are in the high category in the red, which means that we have those findings when the Joint Commission comes. Then the Joint Commission will have to come back in 30 days. Those we definitely want to avoid. But most of the findings were in the intermediate and low category as far as severity. And they were standards that were cited were physical environment. We have a very mature building. Infection control, there was one leadership finding, medication management, national performance goals, nursing and provisional care. But there were a total of 110 elements of performance findings in those standards. So we have some work to do. And some of them were also in the red, so we definitely want to improve those. To address those, we've increased our rounding as far as our preparedness rounding. We increased our meetings from biweekly with the leadership of our department to weekly, and also conducting chart audits. We're also putting everything that was found in the mock survey on the share drive, so everybody has access to that and see how their department is performing as far as satisfying those findings, and compare those so everyone can see how they're doing as far as making improvements. So I feel that would generate a little friendly competition there, which isn't a bad thing. Next slide, please. We want to talk about our workforce. Where you have the project slide graph showing the agency use rate. The target for agency is baseline is now 57 FTEs with a target reduction of 30%, which is 17. Our current agency staffing is at 50.7 FTEs, and we're improving the vacancy rate from 34 to 24%, which is shown in the bottom right-hand graph there. At this point, I'm going to turn it over to Mike Moonen to talk about nursing.
Thank you, Dr. Turner. To piggyback onto the workforce improvements, the bottom left-hand graph shows the total PIDs and the total agency in stack form, orange being the agency numbers. We have reduced agency in nursing by 40% over the last few years. So obviously that has a huge impact on the bottom line. Next slide. Also want to speak to the developing pipeline at Provident. We're very proud to have hosted, and sorry for the typo, it's actually 3 sets of 8 Chicago State University students. Obviously our most important resource is our people, and developing that pipeline is critically important. I think everybody's aware that the market is extremely competitive for nurses.
Yeah, what do you mean by host? You invite them to come in and take them around the hospital, right?
No,
I don't know what host is.
I'm sorry, they have their clinical rotations at Providence. So good question. Thank you, Director Harrington. So we've expanded the relationships with our clinical partners. So, you know, having 24 students do their rotations at Providence certainly bodes well to establish that relationship and potentially secure them as our own staff nurses in the future. We're also working with the Pritzker Travelberg Grant and developing a relationship with the City Colleges of Chicago. We'll be having an MA program that will be on site at Provident. So again, establishing that relationship, folks get familiar with Provident, and obviously the hope is that someday they will become Provident employees and Cook County employees. And we're getting very aggressive, going all the way back to high school. So we are welcoming 4 summer interns who expressed an interest and had to fill out an application. So they will be working with our director in various aspects throughout the hospital. And lastly, as was mentioned earlier, and recognizing some folks who completed their leadership training, Provident also now has cohort number 9, where all of our leaders are engaged in our leadership academy. Next slide. Transformation and growth. So this slide is kind of a one-stop shop look at volumes as they have evolved over the years. You could see the general picture shows that we had a trough in 2020 with COVID and have bounced back nicely in inpatient. Surgery is having an exceptional year coming back, and ED volumes did tick back up, but now they are trending down a bit. So specifically, I want to talk to inpatient, while this slide represents discharges per month. So we have secured back to our 2023 numbers, almost the number of discharges per month. However, our improvements in length of stay, so we're providing high quality, efficient care and driving down that length of stay. So the result of that is the average daily census has ticked down a bit. So we are monitoring that. Surgery, kudos to Javier for all his work as the director of surgery. We engaged in a surgical optimization project over the last couple of years, trying to level set cases that are done at Provident versus cases done at Stroger, and have had some significant improvements this year, and I believe had several months of 300 cases per month already. ED volumes, as you can see, are starting to tick down a bit, and that is something we are monitoring closely. I can say that the ambulance runs have also ticked down since 2023. So the impact of the decreased ambulance runs, those will tend to be your most acute patients. Those are the patients who are likely to populate your ICU and then be discharged to the floors. So that's something we will need to monitor as we move along. I think that's all I have. I'll hand it back to Dr. Turner.
Thank you. Well, just need more update on the surgical services. We've had, the graph shows that we are significantly above last year's volume. That was due to the expansion of GI endoscopy services at Providence that are now there 5 days a week. OB-GYN added another attending to their department, and their surgical volumes up 38%. Looking at, we have a surgical optimization plan, and it's focusing on increasing urology, OMFS surgery, and we've initiated pain service at Providence doing pain procedures in our OR. We have also implemented a process for adding cases that present in the ED that require surgery, select a case, keep them instead of transferring them to Stroger, keep them there and doing those surgical cases at Providence. Next steps are to continue the optimization, continue to monitor the key growth areas, gynae, OMFS, and urology. Next slide, please. This slide just highlights those areas that we've seen a significant growth in: colorectal, gastroenterology. That's a 526%, but as you may recall that we had discontinued those services at Providence last year. OB-GYN is up 35%. Ophthalmology is back on the positive side. That's our busiest service, but they had, for most of last year, they were down and attending for a medical reason, who's now returned back to service. OMFS has added another block time and increased their volume to 80%. And urology, as you can see, has really has increased their volume also by 12%. Next slide.
Dr. Arnold.
Hi.
On your transformation and growth, so if we look back at the traditional way in which we see it in the finance, how are we tracking to budget
With respect
to the surgeries? Because when I look at this information, it looks very good.
Yeah.
So what I'm trying to understand is, how does that measure up to typically how we see it when we see it on the budget?
with respect to the budgeted volume, we're running ahead of that already.
Really?
Yes,
For surgery?
for surgery.
Yeah, right, but that typically has been a very sore spot where it seems to be the opposite. So now you're there.
We're there.
Very good. I mean, that's excellent, fantastic. And while I'm congratulating you, I just want to add one other thing in here too.
I'll take it.
You glossed over it. I'm trying to see, where was it? On your quality and safety, the leapfrog was absolutely fantastic. And the HAI, I'm trying to figure out, can we follow that up and actually spread that across? Because that's, again, I don't profess to be the expert, but to me, it looks like that's extremely good management. From the nursing, the doctors, everyone, support staff, doing a fantastic job.
It's a team effort. We have a great team.
But it deserves to be recognized, which you have it here, but we kind of pushed past it quickly. And I just want to give you kudos for that, and the whole team, the whole hospital. Very good.
Thank you. We appreciate that.
Okay. So, I'll just continue the thread here that Director Robinson put forward. Just congratulations on the leapfrog and the accomplishment of getting to zero. And I think part of it is that the continued work and effort around high reliability that the system has driven, I think, is also translating to some of these outcomes, which is good. So just congratulations on the impact. And then my question is about acuity. Are you seeing more complex inpatient acuity, or has it been consistent? Because I know that that may require some management of approaches and different.
Yeah, if anything, I would say the acuity has ticked down somewhat. So the ambulance runs in 2023 were about 3,200, and they're going to run about 2,200. So the ASI, so the severity level that they rank patients when they come in through the ED, has ticked down slightly, kind of reflecting that. So those will be future ICU patients, obviously in most cases, in many cases. So the overall impact of the ambulance runs going down is a slight tick down in acuity.
Great, that's helpful. And the reason why I ask is, I think, could it be that our integrated system around ACHN, public health, and stronger work evidenced by quality in the inpatient environment is contributing to maybe managing things better and earlier, so that the complex acuity doesn't show up with chronic disease exacerbated or late stages. So that's what I was trying to understand.
And it could be.
Well, that's the goal of population health.
Yeah. So I think we're making some population health progress.
Yeah, that's a good point.
Can we actually make that connection? Because that would be excellent if we can.
I think we can take it into QPS.
Yeah. And Director Bott, the reason why I'm asking the question is because when we started looking at the budget cuts and we started to understand what we need to reduce, make good decisions, because oftentimes we will reduce things that will actually save us a lot of money on the not so long end. But making that connection proves the points, and then maybe drive decisions such that those cuts that will actually hurt us, we won't make.
I think some of the national trends are complex acuity in the inpatient environment is going up. So that's some of the reason why.
Yeah, so we'll have to look at kind of case mix trends and all of that type of stuff. There's a rev cycle component to that too, across the board, that we're actively working on. And I think just kind of future state provident plans, we're working to kind of really lean in on the things that are working, and then also look at kind of what maybe isn't, where are there opportunities to kind of really respond to the community and what they're telling us they want to see happen from it.
So a quick question relative to ED volumes and the reduction. Are we seeing a reduction of ED volumes nationally? Do you know?
I do not believe so, but I would.
And this is why I query, because there is an absolute tie between the last 2 years and the noted reductions in the change in the administration in Washington. And I wonder, do we have a patient population who are fearful to present still? And if the answer is no, it's no. If the answer is yes, it presents us an opportunity to ensure that individuals who come to our facilities will be safe.
Commissioner Lowry, I think, oh, go ahead.
No, I was just gonna say to that point, Commissioner Lowry, we are digging deeply into that because there's a lot of complexity and different variables that could be, we have wondered if it was the activity of, October of last year that is causing just what you're referencing. Trying to get more fine-tuned with our demographic data to do that digging.
Thank you.
Yeah, I was saying earlier this year, we did see certainly in the Midwest and nationally reduced volumes, but in the Midwest particularly, weather, storms, other things,
Mhm.
some of it's care management, hard to
Okay,
isolate, but there was probably 6 to 10%.
thank you.
Yeah.
And that also occurred with EMS volumes dropping as well too,
Mhm.
which may mean for the potential positive, it may mean the improved utilization of outpatient services so that EMS isn't necessary. But there does remain the question of whether there is still some trepidation about utilizing emergency services. There's also been a similar notification, one of our higher indicators in overdoses had been tracking that as well, overdose emergency department visits and overdose EMS calls for opioid overdoses. Those have also comparatively dropped as well too for the Chicago area, over 20% in the from last year to this year. So that's from EMS calls and ED visits. So it would follow that there is a certain trend related to that.
Thank you.
Yeah, and I would just say that you have to look at them across the course of the year. So if you look by quarters, maybe lower in Q1, but then I think by now the volumes rebounded to year-over-year increases for ED volume.
And those numbers tend to increase over the summer, so it'll be interesting to look at the next
Yeah.
quarter that comes in.
Right.
So is this a seasonal pattern change or not? Because usually with additional issues related to violence that may lead to EMS and emergency department calls, other EMS calls increase as well over the summertime.
That's great.
That's what I was gonna say. Maybe we need to segment the different type of ED visits that we have, because that will help us to narrow in where we're seeing the changes occur.
Right.
Then that may allow us to understand what the problem is or what the solution is, why we're seeing that low. Because it could be some of the violence that may be going down, some statistics are showing that, and that may impact it, it may not. It may be what Commissioner Laurie was making mention of,
Right.
but the only way to get to it is to look at those different segments within the ED visits.
Parsing
Last
that
comment,
does
but-
seem.
Sorry.
Parsing that does seem, because also there's been increased Narcan distribution from CCH as well too. So a lot of people are handling potential opioid overdoses in their home because they now have Narcan in their home, and they're no longer interacting with EMS related to that. So that's another method to be able to track. From the goodness of our work in CCDPH to get the Narcan out to everybody, a lot of people are addressing an opioid overdose in their home and not necessarily resulting in an EMS call. So parsing the numbers of what the ED calls are related to would give us a better indication of what may be driving those numbers either upward or downward.
And I think just to kind of pull that thread a little more, our Department of Public Health just released earlier this week an update on opioid deaths in Cook County. I think over the last 3 years, and not to take us off track too far, but 44% reduction in opioid deaths across the whole county. It's actually the best improved
the
county in
largest.
the entire country.
One of the greatest.
Yeah.
Yeah.
Wow.
Best increase.
How does that compare to national trends?
It's actually the best improved county in the entire country.
Yeah.
Same with gun violence, 50%
Right.
reduction over the same time period.
It's great. One other important segment is ambulatory sensitive conditions, to your point, Director Robinson. Those, if you can see those conditions not showing up in the ED and they're actually being taken care of in other places. So that proportion.
Sure. Next slide, please. We have a lot of projects that are currently in place going on at Providence, mainly for our facility. And those are listed there. Ambulance Bay and Ballistic Glass Project. We're going to renovate the Ambulance Bay. That project is actually underway and install ballistic glass on the first and second floors of the hospital, including the ED. The main lobby and corridors are going to be renovated. There's
Well, I must need to have an appointment. They're on the slide, that's for you to see. But a lot of these projects are starting this summer. And also, one of the projects I'm glad to see start is the HVAC project, update, renovation of our system there, replacing all the air handlers that throughout the hospital. And the parking garage update, that includes new camera and the rest button and EV charging station and Wi-Fi for that. And we're renovating the pharmacy clean room at Providence. Next slide, please. You can see a number of these projects are scheduled to start in the coming months, and there is some overlap. So, and of course, the lobby project and those that involve the front of the hospital will affect the access to the hospital. And we plan to have a communication plan to the staff, visitors, and all the staff in Cook County Health, because a number of physicians and other staff members come to Providence from other locations during the week. So we're going to have to make sure that everyone is aware of the changes that we have to make. And we're also going to have a plan to, in case we have, if nothing goes as planned, have a way of pivoting, get some communication out immediately about any changes we have to make for the hospital. Next slide. One of the upgrades that I want to share with you, that is the drawing rendition of the changes in the lobby. One of the things, if you come to Providence, you know that our lobby is kind of dark and not really inviting. This will improve the lighting in the hospital, in the lobby, make it much brighter. We will keep the mural that we have up there. And if you look at the reception desk, what's shown there at the right end of the reception desk, we're going to bring up the cornerstone from the previous hospital of Providence and put it there under glass so visitors can see. Next slide. This just shows the improvements in the lobby, and also the renovation will include the community resource room there and upgrade that, make it more useful. Next slide. With respect to fiscal resilience, nursing agency conversion resulted in a total of 10 PIDs to date, with additional pending. Projected decrease is from $6.3 million in 2025 to $4.8 million in 2026. Our vacancy rate has decreased to 23.5% from 29% in May of 2025. We installed a dishwasher that allows us to serve our meals to our patients on flatware that maintains temperature better, so that the meal is more appetizing. But it also produced over 21,000 per year reduction in disposables, as far as disposable paper, plastic, and styrofoam, which is better for the environment. Our labor cost as a percentage of total expense is down to 42% versus 56% in FY25. Upcoming priorities are inpatient length of stay, which continue to focus on, and topics we're going to monitor is our vacancy rate and expense budget to actual. I believe next slide. Since we're a community hospital, we should have some community outreach. We've had patient education fairs based on the focus of each month. That includes lung cancer screening, cervical cancer screening, colorectal cancer screening, stroke, and mental health. We had a blood drive, and also when the big beautiful bill was announced, we hosted a food insecurity press conference that highlighted the negative impact of the cuts in the SNAP program and the Providence Food Pantry. President Parkwood will participate, along with Dr. Mikaitis, Shannon Andrews, Joche Clinenta, Secretary of Illinois Department of Human Services, and Kate Meyer, who is CEO of Greater Chicago Food Depository, who is also a participant in that press conference. Next slide. And, Bronzeville Health Center opened in April of 2025, our family medicine clinic moved to that location, and we celebrated their 1-year anniversary. And that's a picture of the clinic there, staff there, as part of that celebration. And that concludes our update. Are there any other questions?
Any questions? No, excellent presentation, very comprehensive and illustrates a lot of good things happening. Thank you, gentlemen.
Thank you. Thank you.
Thank you.
Okay, so we do have one item left, and we could choose to do how we want to do this, but I would suggest that we handle this in open session. And this is I hope the final lap in approving the 2026 CEO performance metrics. So there were 2 outstanding items. We asked Dr. Markaitis to go back and expand a little bit more on related to strategy and AI strategy. That Director Bott was wanted to make sure that that it had the right attention that it deserves. So really a strategy, an AI strategy roadmap with near and long-term goals. And then second item was more of a human resources focus around the continual improvement of labor relations through collaboration with labor partners and BHR, so that there's attention around that. Hopefully the staff hear that, because that's the board's way and Dr. Markaitis' way of making sure it's accountable. So I hope that those 2 items meet the satisfaction of the board. I'd like to ask for a motion to approve these, but if we're going to have discussion, then we'll need to go into closed session. So this would be the 3rd month that we delayed this. So I'm hoping that we can get this done right now. So I'll go through the formality of asking for a motion. Is there a motion to accept these?
Seconded.
And a second. Thank you, Vice Chair. Are there any questions or comments? Because if there are, we'll go into closed session. Okay, thank you. All those in favor say aye. Aye. All those opposed say nay. Okay, the motion carries. So do that. And Dr. Markaitis and I will be sitting down. It's not unusual for us to be doing that, but we will have a more formal sit down in the next coming months and come back and give sort of that delayed mid-year review, since we got deep into this process over 4 months, I think. So look forward to that probably in August or September. Come back and report on how we're doing on these metrics. With that, the meeting agenda is exhausted, so I will declare the meeting adjourned. Have a great weekend. Have a great holiday weekend next weekend. Thank you.
Efficient today, yeah.
Okay, both.